Good evening. You have a great city here. Second time I have been here to Edmonton. The first time I got to stop for 15 minutes on my way to Victoria. That's where they routed me, and I didn't know about your wonderful city. Today I've learned a lot just by observing what happens here in the hotel. I have never ever been treated as well in the hotel as I have at this hotel today. Every person that's waited on me at a meal, everyone behind the desk, the maids, everybody, big smile. Is this what happens with Edmonton people? Is this the way you are? But that is just terrific. Well, you deserve to be congratulated for that. I have been duly impressed by you. Where I come from, we're pretty good, but I don't think we're quite that good. Well, today this is brought to you by the Sunlight Institute, which is a nonprofit organization that I formed in the state of Utah, where I'm from in the United States. I was a little cooler here. I left, it was about 82 degrees and the sun shining brightly. Sunny southern Utah, we get about 300 days of sunlight every single year. So today we're going to talk a lot about sunlight. But before I do talk about sunlight, I want to talk about my favorite slide in breast cancer, since we're saying a lot about breast cancer this evening. We take a look at this particular slide by Abbas, or well, the slide is by me, the research is by Abbas. We note that as serum vitamin D levels increase dramatically from 1 step through 5, in other words, what we call 5 quintiles, stepping up from one unit to another, and then we take a look at that yellow bar there, that represents the risk of succumbing to breast cancer. And we note that as we go from the 1st to the 5th quintile of vitamin D serum levels, we go down to a 69% decreased risk of having a breast cancer. I don't think it gets any clearer than that. A dramatic decrease when we increase the levels of vitamin D in the blood. So what are the best sources of vitamin D? The fact is that 90% of vitamin D in humans is produced by the skin in response to sunlight exposure. That's the natural way for it to be done. This presentation offers evidence that the only natural way to obtain vitamin D is through ultraviolet B light. That's the most natural way. It will show you how to get the benefits of optimal vitamin D levels without increasing your risk of skin cancer also, because we worry that we're going to walk out in the sunlight and sure enough a melanoma is going to pop up on us. Nothing, folks, could be further from the truth. Don't you believe it? So we're talking about sunlight versus, of course, the supplements and the fish and the irradiated mushrooms and all the other ways that they make vitamin D today. Now, believe me, if you don't have the sunlight, you're going to need some of these other sources. There's absolutely no doubt about it. So we're talking about what I feel is the best way to get it, which is the way that nature intended it. So here are some of the sources of vitamin D. Full body UV exposure. We were talking a few minutes ago about naked at noon. That's the best way to get it. You know why it's so good to get it that way? Because then you can get a very short time in the sun and make vast quantities of vitamin D. If you try to go out in the sunlight and you're getting sun only on your arms and face, the research shows that that doesn't give you enough vitamin D in the body. And besides, to get enough vitamin D, you have to stay out there all day long, which if the sun is going to damage you, that will be damage, exposing the skin all day long when you don't need to. So we're going to talk about some of the safe ways to get it. Let's talk about cod liver oil, 4,000 to 1,000 international units for a teaspoon. Salmon, 600 to 1,000, that's a fresh wild type. Farmed is virtually nothing, 100 to 250 IU. Fortified milk is 8 ounces. Now, I'm not sure what kind of fortification they use here in Canada, but up until lately, at least in the United States, it has been vitamin D2, which is only about 40% as effective as vitamin D3 from the research that I have been reading. So, if you were going to get up in Carol's, say 10,000 a day to absolutely be at the highest level that you could get, and you want to do that with milk or fortified orange juice, if that's also fortified, that's only going to be about 200 glasses a day, folks. Just 200 glasses a day of milk. And I will guarantee you that that will do you more damage than all the vitamin D that you can take in. You're drinking 200 glasses of milk a day. It'll be fairly heavy after a little while. All right, we've known some of these things for a long time, how important UV light is. UV light from sun lamps, clear back in 1925, was used to help prevent rickets. It's always been known that you can take someone, put them under a sun lamp, and you can help prevent rickets. No doubt about it. Also, post-war austerity Britain, it shows here the folks here working in a mine, and they're also getting their UV treatments because it made them feel so much better, it made them productive. There's research out of Russia and Germany, so many studies that I have read that show the tremendous increase in mood and so forth that is produced by vitamin D. Now, we have known this for a long time. Let's take a look at a few charts of the United States, and you're going to see that some of these also are very, very close to Canada. And we're going to talk here about cancer mortality rates by state economic area. And when you see the red there, that indicates areas which have a very, very high rate of breast cancer. And if you see the blue, which is down at the bottom there, you see a very, very low rate of breast cancer. So if you're taking a look at that, which of those areas do you suppose gets by far the most sunlight? Of course, it's the southern United States. Very low rates there. Let's take a look at another one. Cancer mortality rates by state economic areas. We see virtually the same thing. It does change a touch from slide to slide, but we're seeing mostly the same type of relationship. This is cancer mortality rates by state economic area in the ovary. So ovarian cancer for white females. Again, virtually the same as the others. So we have a lot lower rate where people are getting a lot more sunlight exposure. Now, some people may say, well, you also have other factors coming in. What about what do they eat? You know, who eats best in terms of trying to take care of themselves dietarily? The people up in the Northeast, where you see all that cancer, the people down in the Southwest, or Southeast rather. Well, I'm telling you what, you have never seen such a horror of a diet as they eat in the South. It is terrible. You know, the pig parts, all of the things that are eaten there. Just tremendous quantities of grease and oil and so forth. They actually do better with their dietary habits up there in the Northeast. So we think that it's most likely due to vitamin D levels in blood produced by a higher amount of sunlight in the southern states. Now, if we take a look at Canada here, we're talking about a very high rate of vitamin D deficiency, and of course we just heard a comment from the group when Carol was taking questions that said, no, we just read that that's not really true. Well, if we're taking a look at over 125 nanomoles per liter, there's only about, in what I have seen, only about 2.3% of the people who have that kind of level. And as we see it go to just greater than 100, greater than 75, greater than 70, 37.5. So we take a look at just the last bar there. That would indicate that 10.6% of the population here in Canada is severely deficient, So folks, you Canadians need to really get your vitamin D levels up. And of course you've got what we call long vitamin D winter here. Even if you get sunlight for about 6 months of the year, you're not going to get any vitamin D out of it. And you have the choices either to use sun lamps of some kind, or you need to have the supplements that Carol was talking about. Absolutely essential if you're going to reduce that risk of breast cancer. But not only breast cancer, incredible reductions in the rate of osteoporosis and fractures. It goes on and on. It's not like there hasn't been a lot of research out there. And when people say that, you know, we have plenty high vitamin D levels in Canada, you know, somebody has not been reading the research. There's something wrong there. There's a huge disconnect. They certainly haven't been reading what I have been reading. Now, the following slide shows serum levels of vitamin D expressed in U.S. measurements of nanograms per milliliter. That's a little different than the nanomoles. So as we do that, so not to confuse you, and I think really that Carol has covered this fairly well, we're going to convert by multiplying by 2.5. For example, optimal levels of vitamin D are 40 to 60 nanograms per milliliter in the U.S., which would be 100 to 150 nanomoles per liter in Canada. So let's take a look at this. Where have you seen that picture before? This is Carol's slide, Carol's work with Dr. Garland. Absolutely one of the best slides, one of the best pieces of research in the world is this one right here. Okay, so we're going to take a look at vitamin D blood levels for different populations today. Non-human primates. They get a lot of sunlight, of course. And we have, 50 to, I can't read my slide here, 50 to 80 nanograms per milliliter. Now, how about outdoor working adults, 40 to 52 nanograms per milliliter? That would be a reasonable amount of nanograms to have in the body. And then normal adults, normal, This, unfortunately, is where a lot of you are lying, and a lot of your patients are lying and so forth, is down in this 10 to 22 nanograms. And if you're down around 10, you're just barely above osteomalacia, which is adult rickets, just barely. I have worked with people in the U.S. that live in sunny southern Utah who never get out in the sun. I worked with a lady who had severe crippling in both hips, ankles. She was a massage therapist, actually part-time at the Venetian Hotel down in Las Vegas. And she said, you know, my bones hurt so much and were so weak that when I was doing massage, I could feel my clavicles shifting back and forth. She said, I don't know if she really felt that, but that's what she thought she was feeling. She said, I felt that they would snap at any point. So she gave that up and said a little prayer. And she said that she was led to me. Now, I'm not trying to get religious on you. I'm just telling you what she said. And so I said, okay, first thing we're going to do with all these problems, let's get your vitamin D levels taken. And she was at a 6. She is now at a 45. The crutches are gone. The pains in her shoulders are gone. Her clavicles, thank you very much, are all right there in place, not going anywhere, and she's doing massage therapy again. If you don't have vitamin D, your absorption of calcium is so tremendously compromised in the body. In fact, if you don't have any at all, it's very difficult to absorb it. You can get some absorption, but you don't do it very well. So let's take a look at another one. Here are adults taking 4,200 IU per day, and we got 35 to 45 nanograms per milliliter there. And a lot of you are going to have to do it that way up here when you're not getting your good old sunshine. And then the indoor tanners. The tanning bed is an incredible way to make vitamin D. It's twice as efficient as sunlight because you are getting it on both sides of the body at the same time. And you just stay in for a very, very short period of time, of course, and I know there will be some controversy on that. I'm not really here to speak to that tonight. You do what you want there, but you have to get your vitamin D some way. That is an option. Now, I want you to know that I don't just make this stuff up. I didn't think that the references fit very well where I was talking there, so if any of you want those references, we make them available for you, and I think Carol will also have all of this online a little bit later so you can see these references. So the science is there for everything that I say. I don't make statements without having them backed up. So again, we add one more now. Look over to the left there. These are the people that I call the powers of darkness. One of the presidents of this association, the Dermatological Association, back in about 1996, suggested, this was the U.S., suggested that she could not wait for the day when everybody lived underground so they could totally avoid the sun at all costs. This is the president of the American Dermatological Association. Isn't that an incredible thing to say? But now we have people like Dr. Schuster in the United Kingdom and others in the United States who are saying, we have got to stop telling people this garbage. People need to get out in the sunlight, and they need to be getting their vitamin D levels up. So things are changing, times are changing. Some of the greatest research that we have now is coming from research dermatologists, as you will see close to the end of this presentation. So, having presented this much so far, the question is, if 6,000 IU per day are needed to get 98% of the population above 40 nanograms per milliliter, and if that level is what is natural and intended, then isn't UV exposure from sunlight the only totally natural source capable of achieving these levels? And I would say that's correct. But fortunately, we have surrogates, and that is the good supplements, vitamin D3 and so forth, and you can't do it the other way. Those will also work beautifully. And we would like to see most people doing both. Won't hurt you to take a few thousand international units a day, and every chance you get out in the sun too. It's virtually non-toxic, unless you're doing just something really stupid, like 150, 200,000 units a day for months. You're not going to get in much trouble if you take the small amounts. All right, research shows that there's no longer any question that humans are intended to get UV exposures in quantities consistent with developing a suntan. The powers of darkness also tell us that a suntan is a sign of a damaged skin, don't they? Just simply absolutely not true, and we're really going to hit that here in just a moment. There's no natural way for most people to attain natural vitamin D levels other than regular UV exposure. And remember, you do have that option to use sun lamps of some kind.